SAHPRA has approved Lenacapavir, a long-acting antiviral for HIV prevention, as PrEP for adults and adolescents. Now, this offers a new layer of hope and protection, particularly for populations where infection rates remain worryingly high. Health journalist Mia Malan joins us to discuss what this means for the fight against HIV in South Africa. Mia, thank you so much for the time. Really appreciate it here. I mean, we've registered this at record speeds. How did we get this done?
Yes, it's really been at record speed. We got it done by having some help and also being efficient on our own side. So our medicines regulator, SAHPRA, is part of a program in Europe that is part of the European medicines regulator that helps with processing data a bit quicker. And then the local side of that data, we also had to process here, and SAHPRA put in an expedited application process. What SAHPRA needed to do was to take all the data from the drug maker Gilead that makes this drug, Lenacapavir, and to see if it is accurate, if it is safe, so that we don't end up with medicine in South Africa that's either not safe or doesn't work the way that Gilead says it works. But they've managed to compress that process, and that's why we have approval now. And we're the first country in Africa, and it's the third regulator in the world. Only the US and the European Medicines Agency have approved it before us.
Yeah, very fascinating, and the speed as well as you've just made note of. But you'll remember what happened during COVID, especially when an antiviral drug, sort of a cure of some sort, or some sort of drug comes out, and some may feel quicker than it should have. There could be detractors and doubters to that. How much does this mean, though, to the fight against HIV, considering that there may still be detractors?
There may, of course, be detractors, and I think our health department and also NGOs will have to work very hard in making sure that the right information about this medicine gets to communities. Because as you've pointed out, just because there's a medicine doesn't mean people are going to use it. But we have data that we can work with. And we have a VITS modeling study that shows us if we beef this Lenacapavir, between 1 and 2 million people each year, HIV negative people, take it. If they take it between now and 2040, we could actually end AIDS by then. The reality that we're facing right now is that we don't have enough of it yet. We're going to have 3 phases of rollout, and in our first 2 years, we are going to get jabs from the Global Fund. They will pay for it. And that will only be enough for around 450,000 people over 2 years. So it's not nearly enough to reach that goal yet, but our health department has indicated when cheaper generics become available in 2027, they will allocate budget for that to be bought. We don't know how many doses yet, but they will be able to up the amount of doses that we have currently.
All right, so it's one of those where it won't be as widely available right now. Just talk to us about how it actually works.
Yes, so Lenacapavir is an antiretroviral drug, and that's the same medicine that people who already have HIV, so people who are HIV positive, use for treatment. So doctors and scientists found out over the years that the same medicine can be used for prevention. So how Lenacapavir works is you only have to take it once every 6 months because it releases slowly into your body over a period of 6 months. So that's why you only need to return to a clinic once every 6 months. What happens when you get to the clinic is you'll get tested. You have to be HIV negative. This is for people to stop them to getting infected with HIV. Once you test negative and someone has counseled you and asked you if you think you're at risk of HIV, then you can get the injection. You will get 2 injections. It's 1 dose, but because it's quite a large dose, it doesn't all fit into 1 syringe. So you'll get 2 jabs when you go to the clinic, and you'll also be asked to take 4 pills. 2 pills on the day of the injections and 2 on the next day. If you then return for your second dose after 6 months, you don't need to take the pills again if you return on time for your injection. And you will then have full protection against HIV. It's almost perfect for that full 6 months. Important to know that if you use HIV prevention medicine, it doesn't mean you need to use it for the rest of your life. It means that you use it during periods where you think you have a higher chance of getting HIV. It might be when you're a student at a college and you have several sexual partners. It might be during times where you're not able to use condoms. Maybe you're in a relationship where you feel you can't negotiate for a condom. And it's important to remember that it only protects you against HIV. It doesn't protect you against infection of other sexually transmitted infections.
And also very important to note that it's not a cure. So if you have it, this doesn't necessarily, this won't be able to necessarily take it away. This is actually preventative. So before rather than after. You spoke about that cost coming from the Global Fund that would supply 450,000. Two questions with regards to that. That 450,000, is that sufficient for that 450,000 people? Is that 2 doses per person that you've included in that, which is 1 every 6 months, or is that just 1 dose per person, which then you'd have to split the 450? And the money coming from the Global Fund, does that mean we would then need to try and supplement that payment a little bit later on?
So, great questions. So, the 450,000 people will be phased in over 2 years because that's how long it will start. Between February and on April next year, the rollout will start. And that is enough to keep enough people on Lenacapavir fully for 2 years. But remember, some of them are going to get phased in. They're not all going to get it in February or April. You know, as the program rolls out, people will be added to it. When it comes to the money for that, we don't have to add money for that. We're getting a Global Fund grant every 3 years. And our new grant kicked in this October. And the Global Fund said we could use 520 million rands of that for Lenacapavir. There is, however, a secret bit going on there that the health department and activists are definitely not happy about. So the Global Fund told us that we can budget for $60 per patient per year. In other words, for 2 6-month doses, so twice a year, $60. But that's not the actual price at which they're buying it from Gilead. They're not revealing the price. Gilead has asked them not to say what is the price that they're buying it at, and that secrecy isn't going down well. But I don't think the Global Fund had much of a choice. Either you follow the rules or you don't get the drugs, but activists are most certainly not happy about that lack of transparency. What we don't know yet is Gilead hasn't announced, say the health department wants to buy more of these doses before generics become available. So when I say these doses, the original doses, the branded doses from Gilead, they haven't announced the price for that, and they also haven't announced any information about would we actually be able to get Lenacapavir in the private sector in South Africa.
Yes.
That we have no information about.
All right. I mean, one imagines over time things could certainly change there. Just to also let you know then, here, Mia, we're running a poll question to our audience around this conversation. And we're asking, do you think Lenacapavir will make a big difference in the fight against HIV? And just to give you what the audience has said, we've given them 2 options, time will tell, and yes, less infections. And it seems, yes, less infections is the one leading. But, I mean, it's pretty fairly split in some ways, one might say. Time will tell, also getting 42%. And again, some of those detractors coming to the fore when it comes to all of this overall. Just very quickly for 30 seconds, where does this put South Africa in terms of global health innovation, especially when it comes to HIV and also on the continent?
Well, if we're the first country in Africa who's registered this jab and we the 3rd regulator in the world, I think we're pretty high up there. And if we look at our history, South Africa, there's a daily poll that you can take. South Africa has the largest daily poll that prevents HIV in the world. So there might be quite room for uptake here in South Africa.
Yeah, sounds really, really helpful. At the very least, we certainly hope this continues to improve things.